Hi, this is Dr. Silvester. I'm going to talk to you today a little bit about correcting severe bunion deformities. If you are one of those unfortunate patients that have a deformity that's been present for a long time and seems to be getting bigger and is fairly good sized on the inside of your big toe joints, very similar to what you see on the x-ray behind me, you're in a different category than most patients that come in with bunion deformities. And there are different procedures that are necessary to correct those problems. So I'm going to talk to you a little bit about that and how those can be properly addressed. People with severe bunion deformities need different surgeries than people that have moderate or mild bunion deformities. There are different procedures that are done, and I won't go into that too much, but suffice it to say that those procedures generally require different equipment and a different fixation devices and different recoveries for you. But one of the big concerns that we have with patients that have severe bunion deformities, and I get asked this question all the time, is will my bunion come back? Because they all have friends that have had a bunion deformity, they've had it fixed, and pretty soon they have a bunion again, and you don't want to go through a bunion surgery and have that happen. Rest assured that there are procedures that, if done correctly, you will not get your bunion back again, that your foot will be permanently corrected in 99.9% of the cases, unless you have some unfortunate accident or something that can cause a problem. I think that most bunion deformities that come back are because of the wrong procedure being selected for that patient. And if the right procedure is picked, then the recurrence rate is very low. So in brief, if you get the right procedure, you won't get a bunion back. The other thing people always ask me is, how long is the recovery? Well, thanks to modern fixation techniques, there are ways that you can have your bunion fixed in a relatively short period of time, start bearing weight. Now, that doesn't mean you can be back at full activity. Full activity usually takes 6 to 8 weeks. But walking around, like going to the bathroom and going to the grocery store, that can happen as soon as the day after the surgery. Now, the grocery store maybe not, but getting up and going to the bathroom for sure. Grocery store trips, as long as they're short, probably take you about a week and a half to 2 weeks to do that. As far as being on your feet at like if your children have a sporting event, you have to go to the sporting event, that can happen fairly quickly as well. So just keep in mind that bunion surgery has to be done correctly, the right procedure has to be done correctly, and if that's done, then the combination of those can give you a very satisfactory result. Your foot can be nice and straight, it'll fit better in a shoe, you'll have less pain in your joint, and you'll have a much happier life with your foot. So if you have those problems, give us a call here at Next Step Foot and Ankle Clinic and we can give you a hand. Thank you.